Hello viewers, hope you all are fine. So this is Dr. Sudha and today I welcome you all to this new video that is on your non-communicable diseases, diabetes. Okay, so now we are continuing the classes of Unit 4 of your AECC1 Environment Study and Disaster Management. Okay, we have already covered up to Unit 3 and before going to the discussion, I would like to share something with you that this is a small step taken by me to make this environmental study and disaster management classes through my YouTube channel, and the name of my channel is Environ World for students. Okay, by Dr. Sudha. So you can find my channel by typing my name in the name of Sudhamai Behura or Dr. Sudhamai Behura, and you may subscribe. Okay, so for your better understanding purpose, you please subscribe my channel and share among your friends. And in this channel I have made different playlists for English medium students, Odia medium students in several units. Okay, so unit wise also I have separated different playlists. So up to unit 3 I have made 3 playlists for English medium, and in Odia medium we are continuing unit 2. Okay, today we will discuss the second lecture of your unit 4, in which we are discussing about non-communicable diseases. Okay, so today we will specifically discuss about diabetes. What is diabetes, how it affects, types of diabetes. Okay, and then what diseases takes place due to diabetes, and how we can be cured by the from diabetes. Okay, so all this discussion will be there today. So if you will watch from first to last, just give one look that we will be able to learn about this definition of diabetes. Then your one statistics about diabetes, means how many people worldwide have affected by diabetes. Okay, then types of diabetes. Okay, then your what causes diabetes, means the why we suffered by diabetes. Then how are diabetes and pre-diabetes diagnosed, means how we can know that we are diabetic. Okay, then its health implications. Then how we will monitor our health during diabetes. Then how we will or what are the preventive measures of diabetes. Okay, all these things we will discuss in this video. So before going to the discussion, please subscribe my channel and share among your friends. Okay, so now without any further delay, let us discuss what is diabetes. So as you know, nowadays in every home you will find one diabetes patient, isn't it? So nowadays the child, they are also taking birth as a diabetic. Okay, so diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin. Okay, what is insulin? So insulin is a hormone that regulates blood sugar, or alternatively, when the body cannot effectively use the insulin it produces. The overall risk of dying among people with diabetes is at least double the risk of their peers without diabetes. Okay. So diabetes describes a group of metabolic diseases in which the person has high blood glucose, that is blood sugar, either because insulin production is inadequate or because the body's cells do not respond properly to insulin, or both. Okay, and let us give a quick fact and figures related to diabetes. So about 347 million people worldwide have diabetes, and there is an emerging global epidemic of diabetes that can be traced back to rapid increases in overweight, obesity, and physical inactivity. Okay, and diabetes is predicted to become the 7th leading cause of death in the world by the year 2030. Okay, and total deaths from diabetes are projected to rise by more than 50% in the next 10 years also, and 80% of diabetes deaths occur in low and middle income countries. As you know that we have different types of countries according to the income source. So it is observed that in low and middle income countries, 80% of diabetes death occurs. And in developed countries, most people with diabetes are above the age of retirement. Where in developing countries, those most frequently affected are aged between 35 and 64. Means in countries like India, means our country, means a developing country, okay, and the most frequently affected age of diabetes is between 35 and 64. But in developed countries, it is marked in above the age of retirement. Okay, then let us see the types of diabetes. So while type 1 and type 2 are the most common form of diabetes, there are others that you may hear about: impaired glucose metabolism, or that is known as pre-diabetes. Okay, and there are two pre-diabetes conditions: impaired glucose tolerance is where blood glucose levels are higher than normal but not high enough to be classified as diabetes. Okay, means till this time, means that is known as impaired glucose tolerance. Till this time there will be no high enough to be classified as diabetes, means the level of sugar is within the control. And another is your impaired fasting glucose, that is where blood glucose levels are escalated in the fasting state but not high enough to be classified as diabetes. So these are all pre-diabetic conditions. Means if we will not take care of ourselves in this stage, then there is every possibility that within few months or few years we will be shifted to diabetic condition from this pre-diabetic condition. Okay, then let us see that there are different types of diabetes like type 1, type 2, type 3. Okay, so what is type 1 diabetes? Type 1 diabetes is usually diagnosed in children and young adults. Okay, only 10% of people with diabetes have this form of the disease. And in type 1 diabetes, the body does not produce insulin. So the patients with type 1 diabetes will need to take insulin injections for the rest of their life. And they must also ensure proper blood glucose levels by carrying out regular blood tests and following a special diet. And your type 1 diabetes is known as insulin dependent diabetes mellitus. So destruction of beta cells of the pancreas, little or no insulin production. These are the characteristic features of type 1 diabetes. So autoimmune means islet cell antibodies or congenital absence and may occur at any age, usually appears below age 15. So type 1 diabetes appears below age 15. Okay. But it can occur at any age and it requires daily insulin admit. Okay. And you see here what are the pathophysiology of type 1 diabetes. So in type 1 diabetes you see here that you have the pancreas. Okay. So this pancreas it decreased insulin in the blood vessels. And increased glucose due to low insulin. When insulin will be decreased, then your glucose will increase. Okay. And muscles will be unable to use glucose due to low insulin also. So when your insulin secretion or insulin formation will be lower down, then the muscle will be unable to use glucose due to low insulin. And see here, first your glycogen and protein breakdown causing ketoacidosis, and this will uh, due to the formation of this also your muscles will be unable to use glucose. Okay. And next let us discuss what is type 2 diabetes. So the body does not produce enough insulin for proper function, or the cells in the body do not react to insulin. Approximately 90% of all cases of diabetes worldwide are of this type. Which type? Type 2. Okay. And this is your non-insulin dependent diabetes mellitus. Type 1 is insulin dependent, but type 2 is insulin independent. Means non-insulin dependent means insulin independent. So disturbance in insulin reception in the cells, then decreased numbers of insulin receptors, then loss of beta cell responsiveness to glucose leading to slow or decreased insulin release by the pancreas. Then it always occurs over age 40 but can occur in children also. Okay. And it is common in overweight or obese. So now let us see what are the symptoms of type 2 diabetes. Okay. So it often come on gradually. Have diabetes for long time, pre-diagnosis, and common symptoms are excessively thirsty, then passing large amounts of urine, then waking frequently at night to pass urine, then tiredness, weight loss, blurred vision, frequent infections such as candida. Okay. Then what is type 3 diabetes? So insulin resistance in the brain associated with Alzheimer's disease. Then impaired glucose metabolism in the brain plays a role in the development of Alzheimer's by depriving cells of energy. Then type 4 diabetes. Type 4 is not associated with insulin deficiency or obesity and has been discovered in learned mice, and abnormally high levels of immune cells called T regulatory cells inside their fat tissue, and age-related insulin resistance that occurs in lean elderly people. Okay. Then some people, they may be able to control their type 2 diabetes symptoms by losing weight, then following a healthy diet, doing plenty of exercise and monitoring their blood glucose levels. Then however, type 2 diabetes is typically a progressive disease and it gradually gets worse, and the patient will probably end up have to take insulin usually in tablet form. Then overweight and obese people have a much higher risk of developing type 2 diabetes compared to those with a healthy body weight. Okay. And the risk of developing type 2 diabetes is also greater as we get older. And men whose testosterone levels are low. Testosterone, what is that? It is one type of hormone, testosterone. Okay. So the person whose testosterone levels are low have also been found to have a high risk of developing type 2 diabetes. Okay. And another type of diabetes is there, that is known as gestational diabetes. What is that? This type affects females during pregnancy. Okay. And the majority of gestational diabetes patients can control their diabetes with exercise and diet. And undiagnosed or uncontrolled gestational diabetes can raise the risk of complications during childbirth, and the baby may be bigger than he or she should be. Okay. And what cause diabetes? Diabetes causes vary depending on your genetic makeup, then family history, then ethnicity, health and environmental factors. Then there is no defined diabetes cause because the causes of diabetes vary depending on the individual and the type. Okay. So what are the symptoms? It is marked through picture. Always tired, then frequent urinate, then sudden weight loss, then wounds that won't heal. Okay. Then always hungry, then blurry vision, number of tingling hands or feet, then always thirsty. Okay. These are some common symptoms of your diabetes. Then how are diabetes are and pre-diabetes diagnosed? So there is a basic and widely accepted way is blood test. Okay, blood tests are used to diagnose diabetes and pre-diabetes. Then lab analysis of blood is needed to ensure test results are accurate. Okay. Then glucose measuring devices used in a healthcare provider's office such as finger stick devices and are not accurate enough for diagnosis but may be used as a quick indicator of high blood glucose. Okay, although these are not or not give accurate enough result, but for getting a quick result we have to depend on these processes. Okay, so what are the health implication of diabetes? So elevated blood sugar is a common effect of uncontrolled diabetes, and over time can damage the heart, blood vessels, eye, kidney and nerves. And some health complications from diabetes include diabetic retinopathy, diabetic neuropathy. Then diabetes is among the leading causes of kidney failure. 10 to 20% of people with diabetes die of kidney failure, and diabetes increases the risk of heart disease and stroke. 50% of people with diabetes die of cardiovascular disease, primary heart disease and stroke. Okay. So what are the possible complications of diabetes? Short-term complication, long-term complication. So all the entire complications can be broadly categorized into two types. One is short-term complication, another is long-term complication. So short-term complication means a very high blood glucose level can sometimes lead to coma. Long-term complications are hardening of the arteries, then angina, heart attack, stroke, then poor circulation, kidney damage, eye problems, nerve damage, food problems. Okay. Then complication of treatment like hypoglycemia, that is low blood sugar level. Then how we will monitor the diabetes, monitoring in diabetes? So this is blood test, HbA1c blood test. This is the name of the blood test, HbA1c blood test, 3-4 monthly for monitoring the last 3 months blood glucose average. Then creatinine to monitor kidney function. Then liver enzymes to screen for fatty liver. Then lipid profile to assess fat content in blood. Okay. Then we can also detect by urine test albumin creatinine ratio to detect any damage to kidneys due to high sugar level and high blood pressure. Then BP monitoring, then foot screen to assess nerve damage and decreased blood circulation, then eye screen to screen for damage to retina, cataracts, glaucoma, then ECG to screen for underlying heart problems. Okay. Then how we can prevent diabetes? So without urgent action, diabetes related deaths will increase by more than 50% in the next 10 years. And to help prevent type 2 diabetes and its complications, people should achieve and maintain healthy body weight, be physically active at least 30 minutes of regular moderate intensity activity or on most days. Then early diagnosis can be accomplished through relatively inexpensive blood testing. Then treatment of diabetes involves lowering blood sugar and the level of other known risk factors that damage blood vessels. Okay. Then tobacco cessation is also important to avoid complications. Okay. So insulin injection sites, because we know that when we affect by diabetes, the pancreas, it stops the formation of insulin. So we have to take insulin from the outer sources through different processes or through syringe in different places. So these are in the picture, it is seen through in different places through which we can uptake the insulin in injection. So injection sites are your upper outer arms. Look here, that's the upper outer arms. Okay, both the hands. Then your abdomen. Okay, then your buttocks. Okay, then your upper outer thighs of both the legs. Okay, so these are the portions where we can take the insulin injection. Okay, then diabetes control, how we can control the diabetes. So people with type 1 diabetes require insulin, and people with type 2 diabetes can be treated with oral medication but may also require insulin. Then blood pressure control, then food care and other cost saving interventions include screening and treatment for retinopathy with causes blindness. Okay. Then blood lipid control to regulate cholesterol levels. Okay. Then screening for early signs of diabetes related kidney disease and treatment. Then these measures should be supported by a healthy diet, regular physical activity, then maintaining a normal body weight and avoiding tobacco use. Okay. Then how to treat diabetes? That is through lifestyle change and medications. So lifestyle change can be achieved by exercise, then dietary changes, then medications through oral medications and insulin injections and other injectable medications that reduce blood glucose. Okay. So these were all regarding your diabetes. Okay. So it is one type of uh, non-communicable disease. Okay. And in this video you learn the types of diabetes, what is diabetes, what is the process of our body during diabetes. Okay. And the health problems associated with diabetes, then the some data or figures related diabetes worldwide and in India. Okay. And also the it's a prevention methods and your cure methods. Okay. And how we can monitor the diabetes. So these were all for today. So thank you all for watching this video, and bye for today. and I will meet you soon with another new content of Unit 4. Okay. Till then, bye bye and take care and be ready for your upcoming examination. Okay. Bye.